Hello, I'm Dr. Mona Morstein. I'm a naturopathic physician at Arizona Integrative Medical Solutions in Tempe, Arizona. I have a private practice now, but I used to teach at Southwest College of Naturopathic Medicine in Tempe, Arizona, one of the 7 naturopathic medical schools in North America. I was gastroenterology professor there, and I've had, in my 25 years of being a physician, a decided focus in gastroenterology, which is why one of the tests that I do the most with patients is a very comprehensive stool analysis. Why are we focusing on the stool so much in alternative medicine? Well, that's because you may have been reading in the newspaper or on Google about the microbiome. The microbiome, by definition, is this collection of all the microorganisms that exist in our intestinal tract, which consists of bacteria, fungi, viruses, protozoa, all of these cells together that make up our gut. And in fact, we have more of these microbiome organisms. We have 10 times more of them than we do all the other cells that make up who we are as people. In fact, of our stool, a third of it that we defecate every day are these organisms. A third are the cells of our intestinal tract, and a third are food remnants. So we are constantly using this microbiome to keep ourselves healthy. But nowadays, the microbiome in our intestines is very imbalanced. Why is this? Well, mostly a lot because of the use of antibiotics and our bad diets, such as too much coffee and alcohol and sugar foods and lack of fiber. All of these things, plus the medications that we use, really can destroy the healthy microbiome and cause imbalances in our guts. And as a result of that, we are now knowing we develop a lot of diseases in the gut, but also systemically. So we may get inflammatory bowel disease or irritable bowel, gas, bloating, candida overgrowth, diarrhea, constipation, all of these things in our gut, but we also may be getting diabetes. We may be having problems gaining weight. We may be having autoimmune diseases. We may be having problems with depression and anxiety. We're now knowing that how your microbiome in the gut is very likely going to be affecting you systemically. And so this is a really important thing for us to know, which is why we need to do many times a very comprehensive stool analysis with patients. Now, in standard care, when they do a stool analysis, they're mainly checking for C. diff, which is important because that causes a very terrible diarrhea, or food poisoning bugs such as Shigella and Salmonella, but that's it. But the tests that we use here at Arizona Integrative Medical Solution test for literally hundreds of different changes in the microbiome. We test for how many good bacteria are there, how many of the normal bacteria have overgrown, or do you have any pathogenic bacteria? Have you overgrown funguses, protozoa, amoeba? We're checking for all of this, and if we find something's overgrown, we'll know by sensitivity testing what will naturally eradicate it. And so when we get the gut healthy, as a naturopathic physician, obviously getting the gut healthy is a wonderful thing for people to have, but it's also wonderful for getting systemic illness out of control. So this is why, as Dr. Mona Morstein, we're using stool analysis so often at Arizona Integrative Medical Solutions. Thank you.